currently we're just doing all the lab tests, that general test. When I just say the general test now, we are doing petrol test now. If I can just highlight some of the things we have been doing here. We are doing a malaria test, malaria parasite, of course there is a PS for malaria, which means we are doing for malaria. We are doing for pneumogram, we are doing a PS, we are doing urinalysis, we are doing stenosis, we are doing VRL. VRL is just for the syphilis. We are doing a P24 marker, which means it's for HIV. We are doing a hematocrit factor, that is for arthritis. We are doing a blood grouping, we are doing a gram staining. When I just say the issue of the gram staining is just to identify the bacteria, whether it's a gram positive or gram negative. We are doing ESR, we are doing SARS, we are doing H. pylori, HP, ASOT, Brucella, and the DU test. And apart from that, we just also doing some of the special tests here. We have TFT, we have CRB, H. and PSA. So maybe allow me to highlight some of the things, especially for the issue of the eye. There is a machine here just doing the pulmonograph. This machine I just keep thinking about it is used to do some of the full blood count. When I say here, when I just say that the issue of the full blood count, I mean you're supposed to do red blood cells, white blood cells, and platelets. Is the major factor you're supposed to know, especially when doing for all general clients. You know if the clients have bacteria. One or two may have some of it attached to some of the substance. So it gives you some of the parameter can reveal which things just affecting the issue of the eye. Apart from that, of course, you can just say that is a general test. You can also come, you can just request, and you can do the same test. Apart from that, we are also doing some of the special tests. Not the machine can just look small, but you can include the one for test here. This machine can able to do like 11 tests, but currently we are doing around 5 tests. We are doing CRP. When I just say CRP is C-reactive protein, it shows if there is an inflammation in the body, in any part. It's not specific for the issue of the eye, but just give you some indicators that there is inflammation in the body system. Apart from that, you can do also H1N1 and C. HP1C is a test you to do to confirm if the client is diabetic. You just is average for 3 months to know if the client is diabetic, is it something that just started recently, so give you the feedback. So maybe I can before I move to the other part, there is a difference between a rapid, that is random blood sugar. Random blood sugar is when you just the first time you want to test the body. For example, you have just taken some meals or such. Or maybe you can do fasting blood sugar for a day that day. But for H1, it's just average for 3 months. Apart from that, you can also do PSA. This is just testing prostate cancer. Of course, can also detect if somebody have prostate cancer. And apart from that, also it used to also to determine if somebody have that is TFT. If the client have the direct infection. It can also give some of the parameters that show that maybe the client is able to go for operation. Now, apart from that, what also here is of course, when you just measure the issue of it's a microscopy. Microscopy can do all parameters, especially the wet prep. When I say wet prep, can do urinalysis, can do stenosis, and apart from that, we also can do, of course, malaria. That's one of the things we have just been doing. Of course, when I mention malaria, is also one of the causes of eye effect. But at least can give you some of the parameters and some of the things maybe happening in your body system. Apart from that, of course, here is our page. Let's show some of the reagents because there's a rules supposed to follow. There's every must, especially some of the reagents that are maintained at the level of 2 to 8. If I just open it, some of the reagents that are here, and some of the controls are here, that the machines are operating. Apart from that, we also have here a nice machine. You can do liver function test, and you can do also the kidney function test, that is the UEC. It is a chemistry, and you are just now you can do some of the parameters, and they also help even give the expression to the clients. And here we have some of the reagents, just the way I said there is some of the reagents you can use to do. When there is a prefix, there is a test called gram staining. These are the reagents used to do it, gram staining. You can identify which type of bacteria because the potential I just put into, there's a gram-positive and gram-negative. So this one I can give you the hint which bacteria are affecting the issue of the eye or maybe in the body systems. Apart from that, the machine here, this one is a water pump. They give you the medium in which you're supposed to incubate something. It's a some of the tests, especially some of the tests you just been doing like DU test to rule out if the client the results negative or the results positive. Apart from there, we have a machine. This one machine here is used to separate some of the cells. That is the centrifuge. It's used to spin to separate the blood cell and the serum. So this one can do, when it's just some conditions that there is a serology, you just use the serum to do some of the tests. That is the sample. So the sample is used to do some of the tests like rheumatoid factor, Fusella, and assaults. When I say RF is just the issue of the rheumatoid factors, of course. When you just there is a pain in the joints, there is some more swelling in the bones, the joints. So you can this is the machine I use to separate that sample to do it. Apart from that, you have also some machine here. I can maybe put it on. And this machine also is the incubator. Some of the tests need some of the specific temperature to incubate to make the microorganism to grow. Like maybe if you are doing the culture, apart from doing the culture, you want to do some of the special tests like maybe you want to need to do the blood transfusion. This is where there is a temperature is supposed to regulate, and that a temperature that microorganism can grow, or it is keep the good environment to run a test. One, blood sugar is the most possible of the eye issues. When, for example, if the client can just do operation without you testing the blood to assure maybe the blood is too high, there's a great wound. Of course, there's a wound after operation. That wound can never heal. So it's better maybe to can to test before to give the culture. Of course, there is a normal range, weight range. For example, for the blood sugar is range from 3.5 to 8 grams. So when it's above that is a risky. You cannot do any operation. So it's a guarantee to undergo that procedure before you do that. Of course, the aesthetic cannot even allow that. So when it's above 11 millimole per liter, you cannot allow people to treat. So we cannot allow. Maybe you can just say that you're supposed to go for medication. You just been given a medication to lower the blood sugar. Then it's just allowed to do an operation. Of course, there is also an issue. You are not doing here the issue of the emergency. Where is the issue of when it is you cannot die? Some of us cannot die instantly. They can just take, because when there is a wound cannot heal. Of course, it's possible. After sometimes they're going to face some of the if person can die because of that procedure. My last message about the client here. Currently we just appreciate you are doing the lab test to assure that we diagnose before you treat. So just we just encourage you to come to do all tests. Not only make the issue of the eye. If you are from outside, you can just come and do some of the tests and confirm your body functioning. And apart from that, you can also just pray that before you go for any medicine or any diagnosis, any treatment, just come and do test before you progress. So the solution